All right, we've made it out of the autonomic drugs, and it's time to move on to cardiovascular pharmacology. In this chapter, we're going to cover a few drugs used in heart failure. I know what you're thinking. Heart failure. Why does that sound so familiar? And why does Andrew's voice sound so different? So, I don't know, arrestingly melodic? Well, to answer your first question, in our previous beta blocker symphony sketch, we've already covered a few cardioselective beta blockers that were especially useful for treatment of chronic heart failure. Remember that sad-looking floppy heart balloon underneath the A-beam spotlight, our recurring symbol for heart failure therapy? At the center stage, we also showed that beta blockers actually prolong life in these patients, as depicted by the angel harpist, our guardian angel for improving survival in patients with cardiovascular disorders. In this sketch, however, we're going to cover a few drugs that don't provide a survival benefit. Digoxin, a cardiac glycoside used to reduce symptoms of chronic heart failure, as well as milrinone and nesiritide, two drugs that can be used to treat acute failure. You know, all this talk of a floppy broken heart reminds me of only one thing: senior prom. I don't know about you guys, but my teenage years were like something straight out of a John Hughes movie. There were the nerds, the popular kids, the wastoids, the Emilio Estevezes, and it was all about making an impression at the high school dance. Let's start our discussion with Digitalis, the genus of plants from which cardiac glycosides are derived. These natural inotropic agents have been around for thousands of years, and in 1785, William Withering first described the clinical effects of the purple foxglove plant. Well, fast forward to the rad future of 1985, and you'll see that we've hired none other than DJ Foxglove for the event, setting up a sweet Tears for Fears mix, no doubt. The word DJ should remind you of the name Digoxin, the prototype cardiac glycoside, and the only one approved in the United States for symptomatic treatment of chronic heart failure. At the molecular level, all cardiac glycosides, such as digoxin, inhibit sodium-potassium ATPase at the cell membrane. This inhibitory action is largely responsible for the therapeutic effects as well as many of the side effects of digoxin. But how does this lead to increased contractility? Well, take a look through the door of the gym and you'll see that one of the high school jocks has knocked over a vending machine outside. It's a potassium banana vending machine, powered by 3 ATP batteries, and it's our recurring sketchy symbol for membrane sodium-potassium ATPase. It will become a more prominent symbol in our chapter examining diuretic effects at the nephron. For now, just imagine it as an ATP-driven potassium pump. Usually responsible for pumping potassium into the cardiac myocyte, this ATPase is now inhibited, as depicted by the school supervisor as he rushes over, only to find the door obstructed. And if potassium can't enter the cell, sodium can't leave it. See the sodium-ridden salty peanut snack in the supervisor's hand? Principal Vernon, in his usual party pooper fashion of course, has made sure that it's a dry party. And the only food available is peanuts, our salty sketchy symbol for sodium. This buildup of sodium at the door represents the increase in intracellular sodium concentration as a result of sodium-potassium ATPase inhibition. It doesn't take long, however, for sodium to find another way to leave the cell. This increase in intracellular sodium promotes, instead, calcium influx at the membrane's sodium-calcium exchanger. This is depicted here by this other student holding those sodium-salted peanuts. He's at the back door, sneaking in a few of his classmates while Principal Vernon is distracted. See that ice cream carton getting smuggled inside? It's labeled calcium because ice cream is our recurring sketchy symbol for calcium. All this increased cytoplasmic calcium leads to a rise in sarcoplasmic reticulum calcium stores, resulting in improved myocyte contractility and left ventricular systolic function. Take a look back at the jock who had initially set off this chain of events by inhibiting our sodium-potassium pump. He's flexing his muscles to remind you of cardiac glycoside's net effect of increasing cardiac contractility. Because of digoxin's positive inotropic effects, it can be used for symptomatic treatment of chronic systolic heart failure. So we've brought back our recurring heart failure symbol, that failing and deflated heart balloon, as sad looking as our young prom attendee here, stood up by his date yet again. One thing to reiterate here is that digoxin does not reduce mortality in patients with chronic heart failure. It is used only for symptomatic relief. And because of its narrow therapeutic index, it is usually given only when diuretics and ACE inhibitors have failed to control symptoms. Besides heart failure, digoxin can also be used to treat certain arrhythmias. This is because digoxin exerts parasympathomimetic effects via central vagal stimulation, as well as facilitation of muscarinic transmission of the cardiac myocyte. Direct stimulation of the vagus nerve is highlighted by the sign displaying the theme of our prom, Fabulous Las Vegas. Because cholinergic innervation is much richer in the atria, these actions affect the atria and AV node conduction most, making digoxin useful for treating atrial arrhythmias. For instance, in some patients, digoxin is used to treat chronic heart failure due to systolic dysfunction, as well as their concomitant atrial fibrillation requiring rate control. Because of digoxin's antiarrhythmic effects, let's include our recurring sketchy symbol for antiarrhythmic agents. A rhythm-inducing record, of course, getting spun by our DJ. Stay tuned for more info on digoxin's antiarrhythmic effects when DJ Foxglove makes his return in our antiarrhythmics chapter. Because of digoxin's narrow therapeutic index, toxicity is common. In fact, exam questions will often focus on digoxin's side effects rather than clinical indications, because of just how common and characteristic these adverse effects are. Let me set up the classic scenario. A patient visits your office who is on multiple medications and has a history of heart failure and AFib. Red flag there. And you're presented with some pretty characteristic findings. First of all, his lab values are showing elevated potassium. Remember that dumb digoxin jock who knocked over the sodium-potassium ATPase? Well, the resultant reduction in potassium influx leads to elevated serum potassium levels, depicted by all these potassium bananas strewn across the quad. Hyperkalemia is an important marker of acute digitalis toxicity and is even a predictor of mortality. Also, although your patient has a history of atrial fibrillation, the ECG you got is showing you some fresh new beats. Premature ventricular contractions are the most common rhythm disturbance seen in the setting of digitalis toxicity, though virtually any type of arrhythmia can be encountered. See the heart-shaped dance floor? Let these students getting their Running Man on represent the various rhythm disturbances precipitated by digoxin poisoning. These arrhythmias are potentially fatal. Thus, continuous cardiac monitoring and serial electrocardiograms are performed in the setting of toxicity. One other thing to look out for on that ECG, it's the so-called digitalis effect seen with chronic digoxin use. It consists of T-wave changes, QT interval shortening, ST depression. Though probably the easiest thing to notice are those classic scooped concave ST segments. See the tasty ice cream getting scooped into those very legal and in no way intoxicating beverages? Well, we've highlighted the letters ST, and we've also shown our underage high schooler leaving little concave scoops out of the ice cream. Keep in mind that these chronic ECG changes are not associated with toxicity, just long-term use. Okay, back to that digoxin poisoned patient who's arrived at your office. He's probably going to be bradycardic. Remember that vagus sign? Because of increased vagus nerve activation, activity at the SA and AV node is hindered, which can lead to bradycardia and various degrees of AV nodal block. Take a look at young John Cusack over here, hopelessly waiting for his date to arrive. Musical notes are our recurring symbol for cardiac nodes. And notice that he's standing right on that SA node. Also, let his heart-shaped pocket watch woefully dangling toward the floor remind you of bradycardia. Hey, you see that guy trying to round first base with that classy lady in the prom dress? Cringe. Rejected. So awkward. Notice that they're standing right where the AV node would be, highlighting the excess cholinergic action of the AV node in the setting of digoxin toxicity. This can lead to heart block, represented by the heart shield pendant worn by the girl who's blocking his tactless advances. Remember this effect on the nodal pacemakers. Digoxin is contraindicated in patients with significant sinus or atrioventricular block. See that do not block sign at the back door of the gym? Digoxin should be used with caution when taken in combination with other drugs that depress sinus or atrioventricular nodal function, such as beta blockers. Hence the beta highlighted by the word block. During acute digoxin poisoning, a patient may remain asymptomatic for several hours before developing significant gastrointestinal symptoms. These include nausea, vomiting, and abdominal pain, depicted by the student here who's been out on the dance floor for several hours, showing off his Kevin Bacon, now looking a little nauseated. Neurologic manifestations such as confusion and weakness are also common, especially with chronic toxicity, when patients can present to your office with lethargy, delirium, and disorientation. Digitalis toxicity can also lead to all kinds of visual changes, even alterations in color vision. And you know what? Those visual disturbances are so classic, especially on the exam, that we'll highlight them here as the dancer blocks his eyes from the bright lights of the dance floor. Specifically, xanthopsia, or objects appearing yellow, is a hallmark sign of digoxin poisoning, and that's why we've made the spotlight a nice bright April O'Neil yellow. Alright, there are a couple predisposing factors to keep in mind that can increase the susceptibility to toxic effects of digoxin. One of them is hypokalemia. I know what you're thinking. I thought digoxin caused hyperkalemia because of inhibition of the sodium-potassium pump. Well, it turns out that several electrolyte abnormalities, including hypokalemia, exacerbate digoxin toxicity. This is because hypokalemia actually increases digoxin binding to the sodium-potassium ATPase. Take another look at our scene outside the gymnasium, and you'll see that another jock has stuffed one of the freshmen into one of those potassium banana vending machines. Think of this vending machine as being potassium depleted, and that's why there's room for this digoxin bully to pull the old stuff the first year in the locker gag, representing increased toxicity, if you will. Loop diuretics to treat heart failure are the most common cause of hypokalemia in these patients, but other causes of hypokalemia, such as diarrhea or vomiting, do occur. Renal insufficiency can cause increased patient susceptibility to digoxin's toxic effects. In fact, renal dysfunction is commonly encountered in the setting of chronic digoxin toxicity and is often what precipitates the rise in the digoxin concentration. So we've sketched in another punk senior from a rival high school who's crashed the party. Take a look at the jukebox that he's overturned. Suspiciously kidney-shaped, right? As he jams that flagpole into the kidney, let it remind you of renal damage. And that long tapering flag should evoke an image of the greatly extended serum half-life of digoxin in the setting of renal insufficiency. Assessment of renal function is essential in these patients and should include measurements of BUN and creatinine, as well as urine output to assess renal perfusion. Renal clearance of digoxin can also be inhibited by other medications, including amiodarone, verapamil, diltiazem, quinidine. These drugs alter tubular transport of digoxin, leading to increased serum concentrations. Since a lot of these medications have some use as antiarrhythmics, let's sketch some records falling out of the kidney jukebox underneath our renally dysfunctional senior, which highlights our recurring sketchy symbol for antiarrhythmic agents, some rhythm-inducing records. On the exam, just remember that numerous factors affect digoxin serum levels, especially kidney function. Early recognition of digoxin toxicity is essential, and the treatment for any clinically significant arrhythmia from digoxin toxicity is digoxin-specific antibody fragments, or digoxin immune Fab. Remember that sign highlighting our vagal-themed dance? Let the word fabulous represent those digoxin immune Fab antibodies that are used to reverse toxicity caused by all that extra calcium and vagal stimulation. All right, let's wrap up this coming-of-age comedy by discussing two more heart failure agents, both of which are used to treat acute heart failure. You see, heart failure is a progressive disease characterized by a gradual reduction in cardiac performance and punctuated by episodes of acute decompensation. Therefore, management can be directed towards two goals: reducing symptoms and slowing long-term progression, or treating acute episodes of decompensated failure. Positive inotropic agents remain some of the go-to drugs for treating acute failure. And if you close your eyes for a moment, it's okay, you can trust me. Just close your eyes and think back to that sympathetic summer camp sketch. Got it in mind? Well, recall that we've already covered one of those inotropic agents. Yep, it was that dobutamine girl, doing that beta-1 thing that she do. She was cranking that flashlight just like dobutamine increasing cardiac output during acute heart failure or cardiogenic shock. Beta-1 receptors increase cyclic AMP, eventually leading to increased contractility. And our next drug, milrinone, also works as an inotropic agent by increasing cyclic AMP. Over on the wall of the gym, let's sketch in a few campaign posters for the campus presidential race. The first one represents milrinone, as highlighted by our campaigner declaring that he's 1 in a million. Milrinone is a phosphodiesterase inhibitor, leading to decreased breakdown of cyclic AMP. Don't foster disinterest, highlights inhibition of phosphodiesterase. And increased cyclic AMP is emphasized in the word campaign. As he flexes his knowledge of the Constitution, let that muscle remind you of milrinone's positive inotropic effect. Also, see those big red floppy Democratic ears? Increase in cyclic AMP also leads to arteriolar dilation, which can help reduce afterload in acute failure. But watch out for hypotension. Let's keep this bipartisan and move on to his rival candidate's poster, which will embody all that is nesiritide. This agent is also used in acute heart failure. However, it is not a PDE inhibitor. Nesiritide is a synthetic form of the endogenous peptide, brain natriuretic peptide, or BNP. The phrase bump the grump emphasizes BNP's role in increasing cyclic GMP in smooth muscle cells. This leads to venous and arteriolar dilation, as represented by our campaign elephant's dilated red arterial trunk and big blue venous legs. It also causes sodium loss through diuresis. It is an elephant after all, so we've made his trunk causing some major diuresis as he stomps on those recurring sodium-ridden peanuts. Alright, it's that time. Let's sum up this teen rom-com into a few important points. Digoxin is a cardiac glycoside used for symptomatic treatment of chronic heart failure. It works by inhibiting sodium-potassium ATPase at the cardiac myocyte cell membrane, and as depicted by the principal blocked by an overturned potassium banana vending machine as he holds those salty sodium snacks. Inhibition of sodium-potassium ATPase causes a rise in intracellular sodium. Sodium instead leaves the cell by reversing the sodium-calcium exchanger, leading to an influx of calcium, just like the backdoor influx of unauthorized calcium ice cream. More calcium means more contractility, useful for treating left systolic dysfunction. Besides heart failure, digoxin can be used as an antiarrhythmic. Remember, this is through direct stimulation of the vagal nerve. This affects SA and AV node conduction, causing bradycardia, as highlighted by this dangling heart pocket watch, and AV nodal block, as depicted by the blocked and poorly timed kiss. The side effects of digoxin overdose are classic and include elevated potassium, represented by the bananas accumulating outside, numerous arrhythmias, just look at that dance floor, ECG changes, such as some tasty scooped ST segments, GI symptoms, just give that kid down there some room. He is not looking too hot. And even glaring yellow visual disturbances. Hypokalemia increases susceptibility to these toxic effects, just like the freshman who has increased susceptibility to getting shoved inside the potassium-depleted vending machine. Watch out for renal dysfunction, which can precipitate a rise in digoxin concentrations. Remember that the word fabulous represents digoxin immune fab, the first-line agent for treating clinically significant arrhythmias from digoxin toxicity. Over at the far, we've got a couple of campaign posters highlighting the acute treatment of heart failure. Milrinone is 1 in a million. It is a phosphodiesterase inhibitor that increases cyclic AMP. This leads to some positive inotropic political muscle and floppy, dilated arteriolar ears. Nesiritide, on the other hand, turns the tide by acting like BNP to increase cyclic GMP. This leads to arteriolar and venous dilation, as well as some nutty sodium diuresis. Well, I don't know about you guys, but I'm going back out on that dance floor. Psh, nobody puts me in a corner.